first of all, I think it's very important to understand what we mean by generic drugs. And I have a different sort of classification, so let me try and explain my classification and then we'll see whether how you get the idea. So one is the original drug, which is made, the branded drug, which is patented and made by the original manufacturers. Then is what we have in India, the branded generics, which a company which is Indian based uses the laxity in our patent laws and makes the same brand, but the brand has a name which sells with that brand because it is attached to that, and that was there with a number of companies. It could have been what was initially Ranbaxy, Cipla, Sun, all of them have what I call branded generics. They have a brand for that and that is used for that. And the other is a generic where there is no brand. It is just the molecule's name. So you could have paracetamol, which is Crocin, or Calpol, which is the branded, let's say, generic, or Pacimol, which is another company which makes paracetamol, and the generic, which is paracetamol. So the branded generics in a way are also generics, but they are promoted by an Indian company which is making it, whereas the original is being made by the company which manufactured it, which could be a multinational company. So those are three broad frameworks that I have, and I sometimes feel that we need to be clear on that, because there are molecules which are, and there's an antibiotic which was made by the original company. It used to be, the one capsule or one tablet used to be for 110 rupees. The branded generic which was made by Indian companies was something like 15-20 rupees. So the huge difference. And the generic would be something like 5 to 10 rupees. So those are the price ranges that one would see. The issue here is not about generics per se, it's about quality control. The license to make a product is given by either the DCGI or the state DCGI. And the DCGI argues that they don't have enough inspectors to inspect all the sites. There is no quality control in terms of people seeing that the drug that is made, the dose is enough, the pharmacokinetics is good enough. And therefore, a lot of physicians are worried about the generics because they get made in facilities which may not meet up to the standards. So unless we are able to solve that problem, that all generics will have good quality control, there will always be a reluctance among physicians to use the generics, not the branded generics, but the generic generics. So that is where the whole challenge of the generic drugs lies. So I would feel that we should promote generic drugs because they are cost effective, but at the same time, we cannot play with health. If we are able to have good quality control as far as generic drugs are concerned, yes, they should be used, but a system should be in place so that there is confidence that these drugs are effective.